This short video will be carrying on with our terms to know within our spine unit. The portion of these terms that this video will be covering are spondylosis, a spondylitis, a spondylolysis, a spondylolisthesis, and a retrolisthesis. These are also known as our spondies, if you've ever heard that term before. So I wanted to just do a quick differentiation between these three. So remember, spondy is just a fancy medical term for vertebrae, right? Or spine, but it's essentially a fancy word for vertebrae. So within each of these, except for retro, within each of these we've got vertebrae. We can see right there. And then it's just up to differentiating using this term. So if you remember, an osis is a general condition. It's an overall bucket term for a general condition. An itis, I think you're probably more familiar with that than usual. That means an inflammation. If you remember a lysis, like in a lysosome, a lysis is a crack, or a degradation maybe is a better term. We're going to use it here in this term as a crack or a fracture though. A listhesis is a fancy word for a slippage, if I can get it there. Listhesis. This is just a fancy medical word for a slip. And then retro means backwards, and then we have this listhesis again, and that's going to be a slip. So within each of these, we have a condition of the spine, we have inflammation of the spine, we have a crack in the spine, or I guess I should be saying vertebrae, a crack in the vertebrae, a slipping of a vertebrae, and then a backwards slipping. And we could probably even put like a spondy retrolisthesis in there, then it would be a backward slipping of a vertebrae, but that's not what medically we do. So anyway, that's a quick little overview of differentiating these spondies. And so now we'll dive into a little bit about each one of these spondies. So the first one we're going to cover here is the spondylosis. Remember, this is the general condition of the spine. So the main thing that we're going to talk about with the spondylosis is going to just be the osteoarthritis of the spine or degeneration of the spine in general as a general condition. Realize any type of condition that you may have with the spine may be called a spondylosis. But for this class in this unit, we're going to just talk about it with this arthritis of the spine, maybe some of these small fractures resulting from that arthritis. So you can see here in this x-ray, there's a general degradation of the spine. That's another important point of this spondylosis for this class, is we're going to have deterioration of those discs. You might have heard the term before, degenerative disc disease. I had an athlete that had juvenile degenerative disc disease. That's going to be a spondylosis, right? Degenerative disc disease is the specific type of the spondylosis, but the general term is going to be the spondylosis, which we just use to say, hey, this is a condition of the neck, and there are some effects that are occurring because of this condition of the neck. So your spondylosis can occur anywhere in the spine. I've already mentioned the intervertebral disc. You could definitely be within the facet joints. You may have the formation of these osteophytes you can see here. Just remember, with an osteophyte, anytime the body goes through types of bone healing, especially if it's a chronic type of scenario, we're often going to see these bone spurs, these osteophytes that are going to begin to form because the body is telling the bones to grow. But if the bone is for the most part whole, it's going to begin to grow out, and especially at the edges. And that's why we're going to see these bone spurs begin to develop and form. You can see this cartoon of this here. Moving down, so signs and symptoms of the spondylosis, it's going to be very particular depending on the type of the actual injury. So if we're referring specifically to an arthritis, specifically an osteoarthritis of the back, generally we're going to have our general signs and symptoms that you're beginning to become familiar with our spinal conditions. So a person, as they extend, they're going to generally increase their pain. And as they flex, they're going to decrease their pain. Just remember, you're increasing space in those movable parts of the vertebrae as you flex. When you extend, you're really closing down on the joint and creating some pressure there. Most common places of a spondylosis, especially with that arthritis. C5 through T1, and I think into the lumbar, lower lumbar region here, L5, L4, S1, spinal segments. And then you're going to have this paresthesia, some pain. It's going to be distributed along the area of pain, right? So, or the area of, excuse me, not of pain. It's going to be distributed along the area of malformation or degeneration. So if it's at the L4, L5, S1 region, the person's going to distribute some of those symptoms into those regions of the dermatomes and myotomes. We will have a unit talking about the intervertebral disc. We've talked about the facet joints. So this is just a couple other factors to consider in that spondylosis. We will cover intervertebral discs in a fair amount of depth coming up in a future video. So just realize here that, if we have a disc that has been degenerating, what really that means is you're going to have two discs that are becoming uncomfortable because they're going to be putting some pressure on due to that decreased shock absorbing. So that could definitely contribute to a spondylosis. Okay, moving on to our spondylitis. Okay, a spondylitis. This is our inflammation of the spine. We're going to specifically talk about this ankylosing spondylitis. So this ankylosing is this is a fancy word for abnormal stiffening or immobility. So it's losing its mobility because of the spondylitis, the inflammation. So what is actually going to happen here is we're going to have a chronic condition which is going to cause the bones to want to grow and develop. And what's going to actually end up happening is you can see here the vertebrae will end up fusing over the disc, which will result in loss of mobility at that joint. So you can see this is an actual bone here that has gone through this ankylosing spondylitis, where the bones have actually fused together. You can imagine the results of this type of a scenario. You're going to end up with an individual that is constantly in flexion. And to the point, right, think about our grades here, grade 1, 2, 3. This is not something that will be able to be fixed by exercise, right? No matter how much or how often this person practices their back extensions, this bone is now a solid bone. The most you can hope for is that you don't increase the amount of fusing, right? Maybe you can try to limit the amount of fusing that's going to occur here or the amount of fusing that's going to occur here. But if this person wants to gain mobility between these two spines again, they'll have to go in and do surgery and actually fracture these bones apart to gain that motion back. So this is actually a disease. It's going to affect males more often than females. It's chronic, right? So it's going to be something that happens throughout the person's life. The older they get, the worse it is likely to become. Onset, often 17 to 45. So this could occur early in a person's life or later in a person's life. And then we'll just move ahead here. Realize we can have this ankylosis in other regions of the body. I'm actually more familiar with it in other regions, but you can have it anywhere. This is an x-ray of a normal wrist with our 8 individual carpal bones. You can see the space in between each of the bones, the metacarpals down here. And then you'll look over at the radiograph of this wrist, and this is where the bones you can see are actually fusing together. So this is just another example of that ankylosis. So this would not specifically be a spondylitis, right? Because that would be specifically in the vertebrae, but this is another example of an ankylosis. Moving ahead to a spondylolysis. A spondylolysis. Remember, lysis meaning crack. So what this is going to be is this is going to be a fracture in the vertebrae at a specific part, usually in the pars interarticularis, right there. If you need to pause this video for a second so you can go and refresh yourself on the pars articularis real quick in the vertebrae, go ahead and do that. There is this image here that I have pulled up that is going to show you a fracture in between that pars articularis. Remember, the pars is between the transverse process and the spinous process of that vertebrae. This is most common in the lumbar spine for sure. The lower down you go, the more likely it is L4, L5. Fractured as a result of repeated strain. Most of the time it's going to be extension. So let's take a look at this real fast. So it's going to happen very often in spines that are still developing with growth plates still intact. And more, we're actually seeing this in these young athletes that are specifying in a particular sport and they're playing that sport throughout the year. So you can see it in dancers, gymnasts, tumblers. This is going to be a common one. Here's a dancer. A football player extending. I actually had a few athletes. I had a volleyball athlete that experienced a spondylolysis who she practiced her serving. I don't know how many serves she did a day. I don't know, 200 to 300 serves a day, probably 300 to 320 days a year. She was doing those, practicing that serving. Some football players that were doing this, remember some of our stances for football, the person is in extended position. So they're just putting repeated, constant, excessive strain on those vertebrae. And what is initially happening is they're developing a stress fracture that is then growing into an actual fracture. So we're going to go ahead and look at this image here. It's easiest to see on the cartoon image. You can see it on these x-rays if you take some time and actually and look at it here, but you can see it easily here. So when they have a person in and they're worried about a spondylolysis, they're going to take this oblique view of the vertebrae. And what they're going to be looking at is called the Scotty dog appearance. So you can see here in this image, there's a little, there's a dog, right? This looks like a little dog that you're going to see. So we've got the our spinous process, and then our transverse process is going to be here. And then what we're going to be looking for is a collar on our dog. Okay, so if there's a collar on the dog, let's see if we can see one here. You can see right here, there's a little line. There's going to be a line here, and then there's a line right here. You can actually see this Scotty dog fairly easily as I outline it, if you can look at that. So you'll notice on this dog down here, there's not a collar on the dog. But when you look at this dog up here, you can actually see a collar, which means that that part of the articularis is fractured, and this person now has a spondylolysis. So that's what happens there. Now realize you're going to have in each vertebrae two pars interarticularis, right? You're going to have one on each side of the spinous process. So you can have a unilateral spondylolysis. However, we're going to move into our spondylolisthesis here. Let's say you have a fracture of the pars interarticularis bilaterally, so it's on both sides now. What you can actually have happen, this doesn't happen all the time. Let me mention that let me mention that right here. You can have instances where people have a bilateral fracture of the pars interarticularis without developing a spondylolisthesis. However, if you have someone who has fractured both pars interarticularis, you can have someone that develops a spondylolisthesis where the vertebrae actually begins to slip, right? Remember, listhesis means a slipping, where the vertebrae actually begins to slip off of the base of the other one, of the one that is inferior to it, if you can kind of imagine that. So this is a scenario that can happen when both of those pars have become fractured. So you can see here where this vertebrae has now moved the entire spinal column a little bit forward, where this vertebrae is now a little more posterior to the ones above it. So there's actually a scale. You can see down here there's a scale that they use that radiologists will use to determine the amount of spondylolisthesis that has occurred. So this is just general terms, right? And you can, for this class, we're just going to eyeball these. I'm sure that the radiologists actually take the time to measure these and be more specific. But so a grade 1 is anything less than a 25. We've got a grade 2, 25 to 50, 50 to 75 for that 3, 75 to 100. And then if this disc, or excuse me, if this vertebrae were to be completely off of the one below it, this would be 100% spondylolisthesis. So when I look at this one right here, I would say this one's, I don't know, probably right in the neighborhood of the 25%, probably a little less. So this is probably a grade 1 spondylolisthesis. This is another slide covering that grading scale. So let's go ahead and look at this one. You can see that there's some slipping here. Now I want you to think about your anatomy real fast. If you have a vertebrae that's slipping anterior to the ones below it, what the side effects and the consequences that are likely to result as this happens, right? that intervertebral foramina is going to decrease in space. The person will begin to develop some paresthesia, some numbness, some tingling, etc., etc. You may actually have, and think, is this going to be bilateral or unilateral? Most likely. Can we exacerbate these symptoms? Can we find a way to help these symptoms, right? Obviously, if you extend, that should create and exacerbate symptoms. If you flex, you're going to be encouraging this disc to push back, and it should help the person feel a little bit better. Looking at this one, I mean, this is another example, so you can kind of identify and begin to familiarize yourself with this grading. This one is definitely more than a grade 3. I would say half the disc is, or excuse me, half the vertebrae is here. So this is probably that grade, I don't know, grade 3, grade 4, right in there. It's not quite all the way off, but it's pretty close. I'm going to skip that slide. Don't worry about this slide. In fact, I'll delete that slide as we go through. And then the last one we're going to talk about here is a retrolisthesis. So a retrolisthesis is in reality the exact opposite of a spondylolisthesis. Instead of having an anterior slippage now, we're going to have a posterior slippage of the vertebrae. Remember, this is going to be so much less common because think about all the bony structure you're going to have to go through as a vertebrae in order to slide posteriorly, right? You're going to have to move past some facet joints. You're going to have to move past some spinous processes depending on where you're at in the spine. You may have to move past some transverse processes. So this type of an injury is going to be a traumatic, you're going to have to take a direct blow that essentially forces that vertebrae to move posteriorly. You can see here in this image, right here, this is our spot right here. So you can see that this is an image of a vertebrae that is being pushed posteriorly in relation to the other one. You can also see how the vertebrae above are going to resist that movement. In the spondylolisthesis, they all kind of will move together because the joints above are going to be fairly stable. In this example, this person most likely took a blow posterior, and the vertebrae above it are very likely to resist that movement. Here's a grading scale. You can see this grading scale is very similar to that spondylolisthesis, so you can use that to help frame some of your thoughts. And then here is a clinical case of a person who experienced a retrolisthesis. A 22-year-old labor who had fallen down 8 meters height. So that's a pretty fall height. So this is, again, that's a traumatic, direct blow that is going to essentially push that vertebrae back. They're going to develop some of those nerve symptoms that we're becoming familiar with. Tingling, numbness, lack of sensation, probably lack of muscular control. So that can help you identify some of these Spondys that we've talked about. And that wraps up this video covering the different Spondys that a person may develop.